Today, at Georgia Pain and Wellness Center, I'd like to talk about spinal cord stimulation. It's a procedure that can change patients' lives. The indications of the procedure are with patients with low back, radiating leg pain, with failure of conservative therapy, patients who've had back surgery with persistent pain, and patients with some sort of nerve injury. It can be done in the neck and low back. The spinal cord stimulator has two phases. There's a trial, and then there's an implant phase. The beauty of the spinal cord stimulator trial is that you can try it before actually having it implanted, so you know whether it works or not. I'm going to show you how we do it here using a spine model. Patients who have nerve pain or failed back syndrome would benefit from spinal cord stimulation. And the way spinal cord stimulation works, in the first phase, the trial phase, we place a lead with contacts at the end that produce electrical stimulation to block impulses to the brain for pain. So, for example, if you hurt your hand and it hurts, the first thing you do is typically rub it. You rub it to change the perception of pain. And the electrical stimulator does the same thing for patients with failed back or radiating leg pain. The way we typically do it, in a 15-minute trial, typically, patients will come under, have a little sedation, and we'll place 2 needles into the epidural space, typically in the mid-back, and then drive this lead up into the epidural space under live vision. And the leads will go up as is, all the way up using x-ray. Once we find where the patient's pain is, we leave the leads in that area and tape it up. The patient will go home for a 3 to 5 day trial. If they report 50% relief and an improvement in quality of life, we will then go towards implantation of the device. If the patient does not get relief, then they do not qualify for an implant. So the implant phase is just 2 phases. We place the leads just like we did for the trial, but then we connect the leads to a battery that goes underneath the skin. The battery is then connected to the leads, and the patient now has an implantable system. They are now in control of their pain. So when they have pain and it increases at night, they can turn the stimulation on. If the pain is doing well, they can turn the stimulation off. This has revolutionized patients with scar tissue type neuropathic pain, and has changed a lot of our patients' lives for the better.